earlier this week regarding the president's goal of vaccinating the world. What more do you think you need, in particular, in a supplemental from Congress, for instance, to be able to get more shots into arms globally to hit the president's 70% goal by September, or come closer to it? Thank you.
Good. Okay. Let me take a response first to the question about the covidtests.gov and the at-home test ordering. Today's an important day, actually, in that we hit a milestone: 50 million shipped orders to households across all states, tribes, and territories. That's a total of 200 million individual tests shipped to Americans across the country. So 85% of the initial orders are now out the door. And in the next several days, we will complete the shipping of all of the initial orders. I want to emphasize the Postal Service is doing really an outstanding job here. Once a package ships, over 60% are delivered within 24 hours and 90% within 48 hours. So they are packing and shipping incredibly quickly and efficiently. This is an effort that has no precedent. There's been incredibly strong demand and incredibly strong execution, shipping 200 million tests directly to Americans' doorsteps. Really a very strong performance across the board. In terms of continuing to make progress on global vaccinations, America is clearly leading the world. We've committed 1.2 billion doses to the world, free, no strings attached. We've already shipped well over 400 million to 112 different countries. Each day, millions of doses get shipped. The emphasis is on continuing to supply those 1.2 billion doses, and at the same time to help countries get shots in arms. And that's an effort that USAID and the State Department are taking the lead on, along with CDC, to help build confidence in other countries, to create better access, to set up mobile clinics. And that becomes the effort going forward that becomes most important, is taking vaccines and turning them into vaccinations. Next question, please.
Let's go to Joyce Frieden at MedPage Today.
Hi, yeah, thanks for taking my question. I guess this is for Mr. Inglesby. I'm curious about your efforts in expanding at-home testing. I think people are still seeing that if they want to buy a test, the prices are pretty high. Is anything being done in terms of trying to get the prices down?
Sure, yeah. And so I think, as you know, on January 15th, the administration required private insurers to cover the full cost of over-the-counter tests. So that's 150 million Americans covered by private insurance can now go to a pharmacy or to an online retailer and get over-the-counter tests fully covered. About 50 to 60 million people are now in insurers, covered by insurers, where you can do that directly at the cash register with your insurance card. And we're working with insurers to encourage them to create those point-of-sale options. Medicaid covers these tests. Medicare will cover these tests by spring. So we're moving in the direction where these tests should be completely covered for Americans, and they are now for many Americans.
I'd add to Tom's statement that we've also, in addition to the 200 million we've already shipped free to Americans' doorsteps, we've secured $1 billion in total. So there's another 800 million tests that are either contracted for or in the process of being contracted for that will be available free to the American people. And there are also 20,000 free testing sites across the U.S. Where people can get tested for free at local pharmacies and other convenient locations, including community health centers. So plenty of options on free testing across the country. Next question, please.
A couple of more questions. Let's go to Jacqueline Howard at CNN.
Thank you for taking my question. Dr. Inglesby, you mentioned here on CNN this morning that the government will be making high-quality masks available for kids, and that process is underway. Can you share more details on how is that going to work and when might families get to have these masks in hand? Thank you.
Tom, go ahead. Dr. Inglesby, sorry.
So as you know, that already 230 million masks have been delivered to pharmacies and community health centers as part of the administration's effort to deliver high quality masks around the country. And that process will continue. We are now in the process of planning for the distribution of masks for children. And we'll have more to say about that in the days ahead, but there's a commitment to do that. And there's a process underway, certainly for all adults, to get masks now for free at pharmacies and community health clinics across the country.
Next question, please.
Last question, let's go to Meg Tyrell at CNBC.
Well, thanks. Just thinking about a potential transition to thinking about gauging the pandemic by its effects on hospitals and severe disease. How should people take into account the risk of long COVID as they're considering whether to keep masks on? As we hear, it could be affecting, 10 to 30% of people who get COVID, no matter the severity of their case.
Dr. Fauci?
Well, certainly long COVID is something that we take very seriously. We know we're studying it really quite intensively now over the last year. We know that you don't necessarily have to be hospitalized to get long COVID, that it ranges from people who are mildly to moderately symptomatic to individuals who are actually requiring hospitalization. There are a number of factors that seem to be associated in recent studies with long COVID, ranging from things like type 2 diabetes to viral load to reactivation of CMV, of EBV, excuse me, as well as things like autoantibodies. We don't really understand very much, but we're learning literally on a week-by-week, month-by-month basis. But in direct answer to your question, Meg, you certainly want to protect against all infection. We'd like to do that. We certainly want to protect against symptomatic infection. We'd like to do that. And we don't take lightly long COVID. So that has to be put into the equation of what our ultimate goals are. But clearly the thing that is the most important is keeping people out of the hospitals for the most of the reasons that I think Dr. Walensky explained very, very clearly, that not only relate to the person with COVID-19, but the impact that it has on the rest of society outside of the context of COVID. Thanks.
Well, thank you, everybody. We look forward to the next briefing.